Hello, happy Friday. Welcome to another live here at Candour Beauty. My name is Jacqueline. I'm one of the founders of this wonderful retail store. If you're new here, Candour Beauty is an online retail store that sells hair care, skincare, and personal care for people of color. So today we're going to be joined by Dr. Uchenna, who's based out in America, and we're going to be talking about hair loss and also looking at scalp care. I can see she's just here, so I am now gonna add her on. Hey, she should be joining.
Hi, how are you?
Hi.
Good to
I'm
see
good, thank you.
you.
Good, good. How you doing?
I'm well, thank you. Thank you for having me, Jackie.
Thank you, thank you. You're looking amazing. Thank you
Oh,
so
thank
much
you,
for
as
being
are
with us.
you.
Thank you, thank you. We tried it. It's Friday, so I thought I'll get a bit extra
I
glam.
know. Who knows if I'm going to pour out a glass of wine, we're just winding
I
down
will
for the week.
honestly, like here it's already 7 o'clock. So I was thinking, should I do a glass of wine? But I actually went with tea. I was like, let
You
me
went
let
with
me.
tea. You, you are such a Brit. Let's go with tea.
I know. I was just like, should I do red wine? And I was like, oh, okay, maybe let me not go too hard.
I'm such an
But
American. Where's the liquor? It's 5 o'clock somewhere.
I'm just trying to keep it professional, whatever that means, right? But
Exactly.
but yeah, thank you so much for being here. I'm really looking forward to having this conversation. I think when when lockdown, I predominantly people suffer hair loss anyway,
Yes.
regardless of anything. But I think during lockdown, I was reading, a number of statistics, and I read something about 41% of people have actually started losing their hair because of obviously all the stress, anxiety,
Mm-hmm.
maybe other things. People are losing hair. So I really wanted us to touch on this to just educate our community here. And yeah, so I guess before we start, I really want you to introduce yourself, I think, before I jump, because
Absolutely.
I know you. So I was like, going to pass, like, introduce
I
yourself.
know this is like girlfriend time. I totally get it.
Yes. Yeah.
So my name is Dr. Uchenna Okereke. I'm a board certified dermatologist based in Boston, and I am all things skin and hair, but particularly hair. I have a really deep interest in hair and hair loss, particularly in folks that have Afro textured hair. That's something that I'm very passionate about. And, being here back in Boston, I am going to be joining the team at Harvard, teaching their residents about skin of color and hair and scalp disorders. So this is something that's really, really, near and dear to my heart. And so, well, that's one. So that's a little bit about me. And so why this is even important to me, it's because this is something that for a long time has been very, I would say, maybe not as recognized as it usually, or that may have been in other populations. So I feel that it's important for us to really spend our resources, the scientific, data and manpower to really look into this. So that's just a
And,
little bit about me. One of my
and
many interests, but.
one of, and also just to call out Harvard, hello, that's like super amazing. You let that just end, get drop in the conversation. Come on, that's like super amazing.
Yeah, so but doing that in private practice, yes. So very busy.
Yes.
I'm humbled and very happy to have this
Oh,
opportunity.
wow. Well, congratulations. And I'm
Thank
really
you.
looking forward to what you're going to be doing in the future.
Thank you.
Right. So I guess we wanted to just touch on first exactly what is hair loss, and because also there's hair loss and there's hair breakage. So what are the difference
Right.
between the two?
Such an important place to start the conversation, because what I found is that, when patients come to see me, the two can get conflated, right? So first thing, hair loss is when you're literally having, hair loss or shedding right from the roots. So from the roots, the hair is, like you're losing hair that way. So that's hair loss. Hair breakage is the actual follicle itself, that strand, for some reason is being compromised. And that's when you get, hair breakage. And sometimes hair breakage can be mistaken for hair loss.
Mm.
So I've had some patients come in and say, I'm having hair loss and my hair is falling out. And once I really do the hair evaluation and look at their scalp and take pictures, and we realize that, in fact, this isn't hair loss, it's hair breakage. And that then guides our treatment plan. And we decide to say, okay, what different hair care practices should we be doing, right? To
Yes.
help to restore the strength of our strands, because that's really, where we have to focus.
Oh wow. So how do you then, okay, how is that then diagnosed? Because you said you look at it, you look at the actual strand, and then what then do you diagnose to the patient, or what do they do then to treat the breakage? Because if
Yeah,
your
good
hair is
question.
breaking, your hair is breaking.
So that's a condition called trichorexis nodosa. That's the medical term
Wow.
for it. And there are many reasons that the hair can break, right? So when we look at our hair is, it's keratin and bonds, right? So anything that's going to weaken the bonds will leave the hair more susceptible to breakage. So what weakens the bonds? Well, dry hair weakens the bonds. If we're coloring our hair, that dries our hair, weakens the bonds. If we're
Yes.
straightening our hair, putting heat on it, putting relaxers on it, all of these things, what do?
Yes.
Weaken the bonds, leaving them more prone to breakage, right?
Yes.
So that's when we have the conversation about, okay, what are we going to do to incorporate practices that are going to help us maintain healthier hairstyles, right? So we're
Exactly.
going to have hard conversations. You're not going to be able to blow your hair out all the time. We
Yes.
might have to
Yes.
talk
Yes.
about, going away from that relaxer.
Yes. I
There,
call it the
there is
creamy crack.
the creamy crack. I mean, the creamy crack, we've all, fallen
Yeah.
victim to the creamy crack, but hey, what can we do?
Yes.
And I think it's a hard conversation to, um, I wouldn't say it's hard for me to have, but on the patient side, because I had this conversation with my good friend who's a dermatologist, right? When I was dealing with like trying to transition and figure out what I wanted to do, it's something that you have to kind of plant the seed and continue
Mm.
talking with the patient. I don't expect you in our first appointment to say, okay, I'm going to go natural. I'm with you, doc. I expect resistance. I
Yeah.
expect you to look at me kind of sideways and say, okay. And, we're going to have to just keep having that conversation. And
Yeah.
eventually, I think most patients, if patients are able to, if they decide to go natural, great. But I'm not here to make everybody go natural because everyone has their own path. The key is, are you doing hair care practices that will help to grow, to maintain length retention, right? Are you doing healthy practices that are helping you get away from this hair breakage? I think that to me is the
Exactly.
key. Yeah.
Exactly. And I think also, with us Black women or people of color with texturized hair, when you've been on the journey of straightening your hair and, relaxing your hair, oh, can you hear me?
Hmm.
Yeah,
I can hear
like
you now. Yes.
you've gone through that journey of having straight hair. Some people do it because
Hmm.
it's easier to maintain, or maybe it's
Yeah.
an appearance thing because they want to fit
Hmm.
into maybe the Western
Right.
world, kind of those
Right.
kind of thoughts, or
Hmm.
people's perception.
Hmm.
So it is a very
Yeah.
difficult conversation. It actually is, because I was very much
Hmm.
straight. I used to process my hair. I even did
Hmm.
up until last year, if I'm honest with you. It
Yeah.
was only
Okay.
lockdown that actually made me start again and start being natural, because I
Hmm.
didn't have my hairdresser at hand to help
Right.
me keep
Hmm.
healthy hair. So definitely, I've been here before, but definitely it is a process that we Black women, I think, have
Yes.
to go through. Definitely
Yes.
agree with that. Okay, so then let's touch on hair loss.
Uh,
So how does that, like, what do you say then to your patient, essentially,
right.
like, so
So
you've
if
had.
it is hair loss, so let's say we do the exam, right, and we find, okay, it's not breakage, right? It's hair loss. So then where do we go from here? So
Yes.
there are over a dozen different types of hair loss. So, then it's up to, the dermatologist, or whoever you're seeing to delineate that. And hair is a it's a very fascinating Telogen effluvium. And that's hair loss due to a stressful situation. So that's typically been called the pregnancy shed. Most
Mm,
women may experience it several months after pregnancy. You have this shed, and this isn't really a hair loss per se. I think the hair loss it's a little bit of a misnomer when this categorized as a
yeah.
hair loss, because it's really shedding that hasn't occurred for a long period of time. Because think about it, if you're under a tremendous amount of stress, right? Your body is not worried about shedding the hair that it should have shed. It's trying to take care of all these other functions and all these other duties, right? So your hair, is kind of like, oh, I'm going to pause this, right? But then all the hair that
Okay.
you should have shed over all these months now
Oh,
sheds
wow.
like that. So that's what's happening with telogen effluvium. So, and this happens
Oh,
after pregnancy, and this happens during a stressful period like COVID. This can happen after a surgery, a death in the family. So that's that's hair shedding, right? But the thing is, telogen effluvium many times can unmask an underlying hair loss. So
mm.
let's say you already had a hair loss that was simmering, and then you have this big shed, right? Now that that actual hair loss is more perceptible.
Wow. Okay. So that's really interesting. So basically, it's if all your hormones, emotions, and everything have been
Mm-hmm,
working really hard on the rest of
mm-hmm,
your body,
mm-hmm.
then eventually it just goes straight to your hair. Wow. That's really interesting.
Yeah, it's more so your body's focused on other things, and once that stressful period is over, now your body goes back to its normal function,
Oh,
right? And it's
wow.
kind of trying to catch up. Yeah.
Doing what
But
should have been lost.
what should have been lost gradually anyway. But when we look at that's one, but particularly in women of color, very common hair loss is CCCA.
Oh,
Now, CCCA is central centrifugal cicatricial alopecia. It's a mouthful, but I'll break it down for you so you'll never forget it. It's hair loss that starts on the center of the scalp, and then
mm.
centrifugal means it moves from the center out. Cicatricial scarring, and then alopecia is hair loss. So it's a scarring hair loss, starts at the center of the scalp and moves out, right? And if we've probably seen women with that type of pattern before and you just didn't quite know what it is, and it's really something that is very prevalent in women of African descent,
Yeah.
and something that we're spending a lot of research on to try and treat, and that's one of my main focuses.
Okay, so is there anything we can do to prevent hair loss, or is it just inevitable? Because if you are going through stress and there
Mm-hmm.
has been a pause on what should have been shedding,
Mm-hmm.
it sounds like there is no way to avoid it, or is there?
So that's a good question. I wouldn't, as far as, and I'll answer each one separately. As far
Yeah.
as the stress shedding, there's not anything you can do to avoid it per se, but there are things that you might be able to do to lessen its impact, right? So
Mm,
making sure that you're eating a healthy diet. Sometimes in this cases, I think things like hair vitamins are really important to include into your regimen. I love
yes.
hair vitamins, whether you're having hair loss or not. I
Yep.
think it's great. And some of the brands that I like, everyone knows about Nutrafol, but there's another one, Gashi, which
Yes.
was developed by one of my colleagues in California, Dr. Sanusi Umar, who is just a brilliant, phenomenal hair transplant surgeon and just scientist, and
Yeah.
just really nice nutraceutical products there.
Mhm.
So, I mean, those are a couple of things that one can do. But as far as preventing it, if it's if it's a CCCA or the things, it's identification. I think a lot
Mm,
of the times people are not coming in to see a dermatologist early enough to be
mhm,
diagnosed. So
mhm.
what I find a lot is with my Black patients is, sometimes, it's changing now, but before it would be coming in too late.
Yes, it
Like
was.
there's already a shiny patch or here, and it's just like, come in sooner. So any amount of breakage that you notice, come right in,
You know what?
and let us see you.
Yeah, you said something interesting. So depending on where it is, does it make, for example, with skin, if you have breakouts in specific areas, so for lack of sleep or really long nights, bad diet, you might get some acne or pimples at the top of the head, right? Or some at the
Mm-hmm.
on the edges, right? When it's
Mm-hmm.
hormonal. Is that the same with hair loss? Because when I was pregnant, I actually lost my hair breakage was a lot at the back and nowhere
Mm-hmm.
else. It was just really bad at the back. And then
Mm-hmm.
after obviously I went for my pregnancy, my hair started growing. And then like you
Mm-hmm.
were just saying with CCCA, it's at the crown, at the top of
Mm-hmm.
the head. So does
Mm-hmm.
that matter, or am I getting too complicated? I don't know. Does it
No, it's
matter? Is
okay.
it as easy as that to diagnose and say, oh, because it's starting from here, it may be
Uh-huh.
this?
I would say it's a little bit more complex than
Yes,
that.
yes,
Yeah. And
yes,
it's a good question though, because we always want to try and draw connections and all of that.
yes.
I would say leave that to your dermatologist. Come
Yes.
in, let us see you, and we can
Yes.
help you figure it out. But when in regards to your hair loss, again, I guess I would have to have seen it to know
Yes.
for sure the kind of
Yeah.
hair loss that was going on.
Yes. Yes. Okay.
Yeah,
Okay. Okay.
yeah.
So that's quite interesting. Okay. Okay, because I thought, oh, because it's like skincare. There's always these like mapping, the acne mapping of where you have breakage determines,
Yeah.
what's the root cause of that breakout. You know.
So in regards to the mapping, I think that um, I'm not sure that what I would say in regards to mapping is when I see breakouts usually on the lower half of the face, on women, where if you were a man, you'd have a beard.
Mm-hmm.
That's more of the hormonally
Yes.
driven acne.
Yeah.
So that's really the only thing that I would
Mm-hmm.
kind of cling to in regards to the mapping. The other stuff I think is it's I don't know that it's proven, so I don't know that I would
Yes.
sign on to that. Yeah.
Yeah, yeah. No, that's fair. That's fair. Okay, that's fair. So is there a difference? I guess I was going to ask that, is there a difference with people of color with texturized hair and Caucasian hair when it comes to hair loss? Is there a difference, or are
Uh,
the root causes the same?
right. So good question. Um, I think generally the root causes are the same. So if you have any level of inflammation at the scalp, right? Because with
Mhm.
CCCA, there is inflammation at the level of the scalp that's causing the hair loss. So any level of inflammation at the scalp, if you think about your scalp like soil, right?
Mhm.
And you're a farmer, you
Mhm.
got to have good soil to get a good yield. I mean,
Of
that's
course.
really the bottom
Yes.
line, right?
Yes.
So if
Yeah.
there's any inflammation, any infection, anything going on at the base, you're just not going to get a good yield. And that's true
Yes.
no matter what kind of hair texture you have, right?
Exactly.
I've seen some interesting cases, of things that, you would think, oh, you would only see this in textured hair types, but you see in non-textured hair types too. So I think we can say generally, this and that, but overall, anyone can have anything. Yeah.
Okay.
Mm-hmm.
Okay, great. So when we're looking at scalp care, because you touched on, I think you
Mm-hmm.
mentioned scalp care. So what exactly is scalp care? Because I think from last year, I've been seeing a number of hair products now
Mm-hmm.
contain glycolic acid, salicylic acid, so and they're from what I know from the brands, it's that they recommend using glycolic and salicylic for product buildup and taking care.
Mm-hmm.
So it's like
Mm-hmm.
cleansing the face, right? So
Mm-hmm.
taking care of that skin to make
Mm-hmm.
sure that the hair, when it comes out, grows healthily.
Yeah, yeah, I actually like those additives in shampoos. I think it really helps to, like you said, take care of that product buildup, and also glycolic acid is hydrating, as well. So I think that it has that added benefit. When we look at patients who have seborrheic dermatitis, or sebderm is the acronym, it's like dandruff, but a little bit more than dandruff because you have that kind of, that inflammation at the base of the scalp, a really thick
Mm-hmm.
scale. So for seborrheic dermatitis, I think it can be helpful, to use that as well. One brand that I do like is developed by one of my colleague dermatologists, Livso, and that shampoo has glycolic acid in it. So I think that's, definitely something to be looking out for.
Yes.
Mhm.
Dr. Hope says yes to glycolic acid. Yeah.
Dr.
Honest.
Hope is fantastic. We love glycolic acid.
Yes, yes. It's something I honestly just discovered during lockdown because obviously I don't have my hairdresser, so I was been really looking into it and I started using one. So I kind of treat it like a first cleanse, then go use the
Uh-huh.
shampoo. So like let it
Nice.
sit on the scalp, then
Hmm.
shampoo. But we'll definitely check out Livso. But
Yeah.
it sounds like it's an American brand. That's fantastic. Great. So okay. So would you say, because I can see someone actually asked the questions
Oh,
of
okay.
what is the best hair vitamins for hair?
Hair vitamins. So there are a number. So do they mean like, well, I guess I'll answer I don't know what they mean. I can't ask
Yeah.
them, but I'll say
Yeah.
the vitamins that I really like are Gashi vitamins for hair. So Gashi is spelled Gashee, Gashi. And
Hmm.
you can go to drugro.com to find that. It has a lot of natural things like ashwagandha and
Mm.
fenugreek, saw palmetto, all sorts of wonderful, wonderful ingredients to help grow hair, right?
Yes, yes.
And you know, we've also seen some other benefits as well as it helping with inflammation and things like that. So I think that's one thing. The other, and there's a hair lotion as well that I find to be very nice and has good evidence for. And there'll be some literature that will
Mhm.
come out about the hair lotion. Nutrafol is also wonderful. So Nutrafol, Nutra FOL, Nutrafol.
Yeah,
Also another product that's, you know, excellent for as far as hair vitamins are concerned. But the
yeah.
key, I want to make sure that no one is self-diagnosing themselves, that you
Yes,
always make sure to see
I
someone.
that was actually what I was gonna say next. Is that
Yeah.
like when you feel you are suffering from hair loss, is to always seek medical help first. I think
Yes.
that is really key. It's with
Mm-hmm.
anything, skincare, or even with your health. It's if you
Mm-hmm.
feel something is not right, always seek medical advice
Absolutely.
first before self-diagnosing and self-treating, because you could make it possibly even worse,
Yeah,
right? And
exactly.
that's
Mm-hmm.
and that is really key. I've definitely been a victim of that.
I think
So
we all have.
yes, yes. So definitely always seek advice, because I think so. Staying on ingredients, so just like in skincare, like for
Mm-hmm.
us, especially here at Candour, we really believe formulation is key. So no
Mm-hmm.
two products are the same, of course. So is that the same? Would you say for hair care? So like you've mentioned a number of brands, and I think you've obviously mentioned them because that you recommend them, you think they're fantastic. So is
Mm-hmm.
formulation key?
I think the formulation is key, and also the ingredients are key, right? So definitely looking at the ingredients that are in certain products and, you know, how they're going to benefit you. Yep, definitely very important. Very important.
So is it best to say you lead with ingredients, for example, like lead with
Yeah,
ingredients instead of
I would
like
say,
product and brand?
right. I think I would, yes, this actually came up in another conversation that I had. I would say you definitely want to lead with ingredients
Ingredients.
because in as much as we love pretty things on the shelf and they look so nice and
Yes.
tantalizing and we get caught in buying so many things, you do want to focus on ingredients because that's really where you're going to get the most benefit.
Yes, definitely. We definitely agree with that. It's the same with skincare. You always should lead with
Yeah,
ingredients. Yeah,
always lead with
not just the
ingredients.
pretty packaging.
Mm-hmm.
Not just the pretty packaging. Okay, fantastic. So because we're speaking about people seeking advice
Mm-hmm.
on the first step, when is that? Because we know, okay, when you feel if something is not right, seek advice. But what are the telltale signs you're looking for? So what are these symptoms that you're looking for to seek advice?
Good question. Such a good question. I would say if you're noticing more hair shedding than usual, like if you're cooking and you see hair, you know, on the, you know, along the kitchen counter, if you see it, you know, on your pillow, if it more than usual. I mean, a few hairs here and there might be reasonable, but if you're noticing consistently there's hair on the floor in the kitchen, you're not doing your hair in the kitchen, but you're seeing hair there, you know, that's one
Yes.
thing to consider. I would say if you're having any
Mm.
itching or tenderness or uh, uncomfortable sensation on the scalp, that's important because it's funny. A lot of patients I've seen is, oh, I just have a little itching. That's not
That's
normal.
yeah. It's like your skin is telling you something.
Yeah, your skin is telling you something. That's the
Yes.
skin's way of telling you there's something
Yes.
going
Something.
on here.
Yes.
So
Yes.
yeah, but those are really, I think, important signs to pause and say, okay, this shouldn't be happening, you know. And you know, if you've tried the over-the-counter dandruff shampoos and that's still not doing it, it's probably time to come in and see a dermatologist. Yeah.
Oh wow. Wow. So wow. That's so. In a nutshell, what would you say? Okay, I was gonna round it up. So in a nutshell, um, would you say, because we that's what I'm saying in a nutshell, breakage, because we touched on this at the beginning, breakage, sometimes your hair, anyway, like I guess you said, you dissect that under microscope and look at it
Mm-hmm.
much closer, because I was
Or a
gonna ask
clinical
then, like,
exam. Yeah. Mm-hmm.
yeah, because it's like with breakage sometimes it's just your hair is snapping, so like we said, the strands are really weak,
Mm-hmm. Mm-hmm.
so I guess, yeah, it would be definitely coming in to see you, or a
Yeah.
dermatologist.
Yeah,
Yes,
it takes a long time to get all these skills. It takes a long time
honestly.
because you have to literally, like look at the strands and oh, it's just so involved. It'll be another IG live.
Oh, really? Can
Another
you
IG
touch on
live
just
this
the
way.
process really quickly? What is the like?
Yeah,
Is there
so
like a three-step? Yes.
yeah. So if I were to do it in like 30 seconds, I know we're running out of time. When I have my patients come in, there's nothing in your hair at all. No braids, no weaves, no nothing. If there's anything in there, you gotta reschedule, right?
Hmm.
So I need to be able to look at your hair, even the part of your hair that is healthy, and you're saying I don't need to focus on it. I need to see that because I need to compare healthy versus not, right? And I have my magnifier. I'm looking at your follicles on the scalp, looking to see if it's healthy, looking to see if there's any pinkness, sign of inflammation. Then I'm looking at your hair follicles. I'm pulling. I'm seeing if they're broken, frayed, dry. These
Mm,
are the things that I'm looking for. And this is what will, clue me in to making the correct diagnosis.
of
Yeah.
course.
And
So
that's
it's
just summary.
oh wow. Okay. So then of course you're going to prescribe whether it's a
Mm-hmm.
medical led product or it's an over-the-counter product,
Right.
right?
And maybe a combination of the two. It could
Oh,
be,
okay.
a combination of the two. It's never either or. I think we can pull from many different sources. There's another, there's conversation about chebe powder,
Mm,
and, a lot that's been really hot out there. And, you know, okay, there's not scientific data for it per se, but I'm still an African woman. And I'm like, I know a lot of these things that our grandmothers did worked. So
yeah.
I think there's something to that, and I think it's worth exploring. So I try and look at it from that perspective.
Oh wow. Oh nice.
Mhm.
Okay. Well, thank you so much. I think I've learned a lot. CCA, right? I think I have to remember that.
Triple CA, yep,
Triple
CCCA.
CA. Yes, yes, definitely something I'm taking, gonna continue trying research on that and learn more. But thank you so much. I really, really appreciate your time this Friday
Thank you for
afternoon
having
for
me.
you.
Yes,
It's been great. And
thank
all
you.
anyone watching, this is gonna be saved on our grid, so you can happily watch it back, and then you can pause and write down all the great job. Yes, that's what I got distracted. Yeah, yeah, and write down all the great points that Dr. Uchenna has shared. Because honestly, it really is a struggle with anybody who's suffering from hair loss. I know that pain. I know that frustration. It's very,
It is
very,
frustrating.
it is very frustrating. And like
Mhm.
you said, if you are seeing more hair than usual shed, definitely seek help, because it's better to do it early than
Yeah,
later.
absolutely.
But thank you again.
Thank you so much for having me, Jackie. You have a good weekend, okay? Enjoy.
Thank
Have a
you.
glass of wine now.
Thank you. Have a good weekend.
Okay, bye-bye.
Awesome. Bye.